Hey, I'm Mary. I'm an avid golfer. I do Orange Theory, I spin, I hike, I do resistance training. I do pretty much whatever I want. It's really important to me that if I get any kind of ache or pain that I address it right away before it becomes a serious issue. So I was looking for a functional movement specialist, and I happened to find Symmetry, which made me really happy. Symmetry is excellent at treating the cause instead of just the symptom of whatever's bothering me. It's a really holistic approach to the whole body working together. So if I feel a pain in one area, it may actually be tightness somewhere else. I've had physical therapy before for my forearm, actually both golfers and tennis elbow. And in those cases, there was a specific set of exercises and some ice and rest that were prescribed. And while my arm did get better, it's been a continuing problem for me. However, since I've been coming to Symmetry, it's really much improved because we discovered that the problem was not actually my forearm, but some instability in my shoulder in the back. And so through strengthening those muscles, I've really been able to eliminate the forearm weakness. And that's a real example for me how it's a systemic view of the body and not a specific injury that's being treated. And for me as an athlete, that's really important. The minute the door opens, I'm greeted, I'm brought right back, and we get started on work. I've never once seen them be late. The therapist always asks me when I come in how I'm feeling, and if I'm feeling tight in a particular area, we may work on those tissues, stretching them or with some kind of a therapy, and then move to the floor to see how that's affected my range of motion, how that makes me feel, if it feels better, and we can move seamlessly back and forth between the table and the floor, between the exercises and the therapy, so that we really get a feel for where we are and make forward progress. Both my husband and I come here. He found it, I found it first for him, and then I started coming myself because I saw the treatment that he was getting, and it was really important. Symmetry doesn't have a preset schedule that we essentially follow. Some of the mobilizations that I started with in my treatment, like Maitland, we're no longer doing because I've essentially graduated from those. In other words, my hip socket is mobilized enough that we don't need to do that anymore. It's something the therapists are always checking to make sure that I continue to have that range of movement. It's really very progressive and adaptive in a way that I've not been used to with other physical therapists. Kind of fun. It's therapy.